What is going on, guys? I am live. This camera always messes me up. So hopefully I've got the right mic on this time. If you're watching last time, I do apologize. The audio sucked because I was picked up on my Bluetooth. But for this episode or webisode or whatever, let me put this sucker on vibrate. My phone's blowing up. We've been crazy busy today. Hi, my name's Casey Cochran. I'm founder of Fit Food Fresh. If you're not familiar with who I am, on this channel, I discuss the meal prep business. That is what Fit Food Fresh is, and that's all I can remember right now because it's been a very long week. So as you guys know, guys and gals, if you've been following for a while, we're working on the website. We've got a great piece of software coming, but it is fighting us every step of the way. Our website crashed Monday, and I think I already put up an episode about that, or I mentioned something in the private group. I forget, honestly. It's been, like I said, I'm barely running on anything. My voice is raw, and hopefully tomorrow is going to be a lot easier. But we had our existing site, which was supposed to be lasting us indefinitely, just had some flaws and some limitations that we were going to be avoiding with the new site. It crashed unexpectedly about 1:30 Monday. We then had to rush putting together the new site, and I still don't know when it's going to be ready. We put it together and got it up, I think late Thursday, or maybe that was Friday, and we barely had enough time to get orders in. We had to do a lot of stuff manually. We had food that was ordered and in the production list, but was then edited, and when it came down to packing, it was incorrect because it was the version of whatever the ticket was in the beginning of the week, and then at some point people said, I want to change it, and the change wasn't taken. We had crazy amounts of issues. And we're not new to this. As you know, if you've been following me, this is year 6 for us. This is year 7. We've done this 6 years. We started in 2014, January 2014. So we've been doing this a while, but you only become more vulnerable and more dependent on the software that you use. Just like what I'm witnessing in society today. We've got the coronavirus going on, and that's something we'll talk about. For sure, because it's on everyone's mind and I can't not talk about it. But the coronavirus is definitely a big reminder of how, at the end of the day, sorry, I'm not making eye contact. I'm busy trying to think. At the end of the day, we're still very vulnerable. And if anything, the technology that we have that allows us to do so many amazing things is also what we're heavily reliant upon to do all those amazing things. And once that's gone, if we're used to doing those amazing things that we took for granted, like getting orders taken and everything done automatically, billing and order tracking and changes and all this other fun stuff, when that's not done manually, and then you go back to the limited labor force that you had that was adequate for that model of the business, now they're overloaded. We've also got some people who are now out of the office. We parted ways with some people, and maybe I'll discuss that more on another episode. But this is going to be more about the website, our week, and what we're dealing with related to the coronavirus. So customers are calling, and we've got new people obviously trying to join with our website right now. If you go to it, it's blank when you go to try to order. So that's bad. It could be worse. It could be completely down, so you can't even contact us. But obviously, people aren't putting orders through, so we don't have any new clients easily signing up. I think we'd have a lot more because of the coronavirus being such a concern right now. So once the site's up, I expect to be able to grow as long as we're able to produce food and deliver food and get food. And let's address that. So far, we believe, and this is just based on the information that I have now, as of the 16th of March, 8 p.m., we were kind of tipped off that there's going to be we knew that there's probably something more than this, but we believe now there's going to be a curfew coming starting tomorrow night. As far as we understand it, for businesses and delivering people's food, we would be exempt. So our drivers should still be good. Getting our supplies should still be fine. We do production during the day. As I understand it, it's from 9 p.m. till 6 a.m. So it's really cutting down on nightlife kind of stuff. And that's really the big spreaders, the social, getting out there and getting in front of a lot of people. The average person doesn't really come in contact with too many people on their day-to-day kind of thing. It's when you go out to happy hour and you start enjoying all those nighttime festivities that the social problem and everybody breathing the same air becomes an issue. So that's really what they're focusing on. I think that as long as it doesn't get crazy, I don't think we're going to be locked in our houses or anything. I think that maybe got to where it was in China, but you have to remember that was the epicenter of where it was. They were very afraid. There was a higher mortality rate initially because everyone was caught off guard. So I think the response had to be a bit more severe to contain what was already spreading so viciously. Now I think with early procedures like a curfew and maybe even some kind of a restricted quarantine nationwide, I think that would help us even out the spike. Everyone's seen those graphics by now on social media where there's the spike of how it looks when you don't do anything to contain it, and how like some of them have a specific incidence. Like I think during the influenza, one of them talks about how Cincinnati or whatever canceled all dances, all city hall meetings, all this, that, and the other, and they were able to have this kind of response to the Spanish flu, and it's like the 1918 one that everyone's talking about, and then some other city, I don't know, Pittsburgh, some other comparable city, didn't take the necessary precautions, didn't cancel city hall meetings and everything, and they saw a much bigger, more severe, instance. Had one meal so far today, and even that was a chore to get down. Crazy busy today. Website's down. The orders, as I was mentioning before, were a bit mixed up. We still have people delivering now. I think the latest delivery I saw expected was 9:30 at night, and that never happens. So this is crazy. So far, everybody who we've had a chance to speak to is being great about it. But tomorrow is going to be another day, and we're going to see if there's people who maybe didn't reach out to us today, maybe didn't get the resolutions. Because as you'll experience, someone will fail to receive their food in the morning, or there'll be an issue in the morning, and they don't call to reach out to you about it, and then it's your fault. Really, when they finally explode about it. It's hard to proactively reach out to everybody when you have several hundred members, and it's also a bit annoying. So it's not like we can check up on everybody every single week, every single delivery. But in this instance, we're going to try to get a list together and try. Unfortunately, is the word we have to use, because right now we are running on a decreased staff. We've got some new people already in. We're very thankful to have them in so quickly. And but we've got new people who aren't going to be as fast, not as proficiently versed on everything, and whatever else. But we are going to try. Sorry for the rants. We're going to try to get the list of everybody who had any kind of delayed delivery. Make sure that they're reached out to, and made sure that everything's good with them. Got everything else straightened out. Credited them if needed. We're all about customer service, so we ideally would have been ahead of that today, and this is some definite some solid gold customer service tips. Get ahead of it if you can. If you know during packing that you're short a snack, make sure the team in the morning has that person on a list, so they're able to reach out and say, hey, I know we shorted you on the snack, I'm crediting you. Get ahead of it. So that's a little bit about customer service. More about coronavirus. Again, people are calling and asking us what's going on. We had a couple come in who were wearing masks. I think it was only them. There I go, touching my face. Asking about what procedures and precautions we're taking. In my other video, I told you guys what we're doing, so I'll spare you from that. You can go check that out. I think that was a live video as well. No, I recorded that one. I feel like I told you guys, but I didn't. I told a camera. And I don't think I'm going to go live with that one. I'll just tell you right now. So things that we're doing, and I'm going to forget some, but aside from the normal stuff that everyone's wearing, gloves, masks, your regular sanitation, and I explained to them that we take all those steps too. I explained to them, the red sanitation buckets at everybody's station, how we've also assigned team captains who are now in charge of 2 to 4 people in their section, depending on which area it is. Like cold prep and proteins and everything. So we have these different areas, different captains, 4 captains total, plus the sous chef and the executive chef, who are actually more captains than that, who are monitoring everybody's. They're monitoring temperature. They're looking for any kind of symptoms. Anybody with any symptoms is told to stay home. Our people are salaried, so they've got there's no incentive to come to work when you're sick or when you're at risk. They obviously want to work because it's part of a team. So they aren't going to we got rid of the type of people. We did a good job at weeding out the type of people who would take the opportunity to take a day off just to get paid to sit at home. So the people who are here want to be here to help their team, but they also understand that they don't have to put their team at risk if they're under the weather. So I think it's going to be a good balance. It's something we already had set in place. Not many people do that. Normally, you pay hourly. There's a lot of arguments for that. I'm not saying that salary is the right thing to do. It's just what we wanted to do. We're kind of like, golden rule kind of thing. So we try to treat the company or set up the company to be structured in a way that makes us want to work for it. So might be stupid of us in this situation. It happens to be good. A lot of companies are talking about like, oh, we've got all this, paid time off that people are able to get and all this other stuff. If anything, that incentivizes them to work when they're sick. I'm sorry. Never mind. I'm sorry. That incentivizes them. Actually, I guess it doesn't really do anything. I didn't know where I was going with that. I was thinking of overtime. I'm very tired. I'm very sorry. Hope this is of some use to you guys. So where was I? Speaking with members, walking through our different procedures. We got the captains, told you about that, temperature monitoring. Also, if I told them about just general ideas of if you have any elderly people who you don't have to go see, you will be putting them at risk when you do see them. So maybe not do that. Also, if, I can't tell you guys not to go out socially, but if you can avoid that, that's also, because I don't know what news they're listening to. I don't even know if they have time to listen to the news. And there's a lot of hearsay, so they might be hearing the wrong things or not everything. And I've been hearing a lot of new ideas that are actually interesting. One that I've heard of that is interesting and seems to make sense. I did a quick Google, but drinking hot liquids supposedly helps, because one of the things with this virus in particular is a lot of the virus it becomes airborne, and that's the biggest threat. Obviously, we can stop touching our faces like I keep doing, wash our hands, but then speaking around other human beings is something that we normally like to do. We normally like to do it in air, or inside under air. And I was explaining to them that supposedly drinking warm liquids helps flush the potential airborne, the viruses that could become airborne, down your throat into your stomach instead of something you breathe in or expel out. So as I understand, I know you can be infected without having symptoms. So I guess that would be the symptom kind of range where you're still working. You're like, no problem, and you have real intentions to go home as soon as you feel sick. You just don't feel sick yet. That's the big danger, as we all understand now. It lasts very long on surfaces, which is where the sterilization, the gloves, and all that other stuff comes into play. Then also wearing some masks, even if they're not N95 masks. Something's got to be better than nothing. I'm not a scientist, but that's what I'm assuming. I don't think anybody will hold that against me for assuming it's better than face-to-face, right? We also, fortunately, you should be working in a kitchen that has a hood, unless you're doing just cold prep. We have a kitchen like that across the street. They don't have a hood system. All they can do is chop up veggies, I guess. I don't know what else they do, roll protein balls. But with ours, we've got the hood system, and you've seen that in some of our videos. Big hood system, sucks out a lot of air. Does it fast, does it constantly. So it's pulling out everything that we're exhaling, and then the other side of it is pumping in fresh air from outside. So that room is actually the best room as far as safety is concerned, as far as I understand. And again, I'm not a doctor, a scientist, or air condition expert, but from what I understand, I know how ACs work, and it just circulates the air that's in here. Actually, it takes some of the air from the dead space up there. Actually, no, that's not part of the system. It's a closed loop system. Again, I'm really tired. So it just circulates the air. So it's not going anywhere. No new air is coming in. This air is not going out. With it going outside, new air coming in. Kitchen's actually pretty safe. What else? There's some other stuff. I explained how general things like how the kitchen's set up with hand sinks everywhere, and how that's one of the safest environments they're ever going to be in. And when you think about every other opportunity you have to get food right now, it's either going to be coming from a kitchen that probably doesn't have our health inspection. We also able to. It's a great thing to have. An important thing to have is a clean health inspection report, because in instances like this, I can just tell them, go and look at it. Now, we have little things here and there. It's not perfect, but when you compare it to any of the restaurants that they've been to, they're going to be shocked. And that's what I always invite them to do, because they don't know that, like, not having paper towels in the paper towel dispenser, they don't know, like, it'll say like it's a minor thing, but they don't really know, like, that's nothing. That's not rats that are seen in some of these restaurants. Like, so when people look up their reports versus our reports, puts things in context. And if you have a good health inspection report, definitely going to behoove you. All right, we're at about 20 minutes. I'll try to wrap this up quickly. Corona stuff, what else are we talking about? As far as our suppliers are concerned, I think I mentioned this before, we're not too concerned. From what I can observe, it seems like what we're seeing on the shelves, them being empty, than what we're not seeing on the shelves, that is a product of it's not insufficient supply, it's irrational demand. So think about that. There's plenty of supply, it just has to get there. And the system's not built to move that much product, because people don't shop like this, except for, like I've mentioned before, in hurricane season in Florida, we see that. We see, especially people who are experiencing their first hurricane season in Florida, they freak out a bit more. They don't know how to handle it. All they know is they've been watching it on the news from outside the country. Or outside the state, and this is the one thing they've always been concerned about, and now it's happening. It feels like D-Day. They buy everything. They rush to Home Depot and they buy up all the lumber, and they rush to Publix and they buy up everything. And a lot of people buy it going, oh, I'll just return it if I don't need it and get it back on my Amex. Yeah, okay. Well, there's also people who need to eat today, and you're buying stuff off the shelf that they need. There's also people who are being pushed into panic. They might not be at panic mode, but you push them into panic mode when they see enough empty shelves, and then they start buying everything, and then there's more empty shelves, and there's more people like, oh, wow, 5 days in a row, I'm starting to always see empty shelves. Next time I see anything in a box or being delivered by a stock boy, I should be ready to get in a fist fight to, get whatever I need out of it. And people get crazy. So irrational demand is our problem right now, not an insufficient supply. There is going to be stuff that we would feel if this persisted for a long enough time. We would definitely feel it. But the largest problem is people have, 6 months of toilet paper in the garage now. You don't go through that much toilet paper. It is important for you guys to have, but there's no reason any of the shelves should be empty right now. We produce it in this country, from what I understand. At least some of the big boys do. I don't know if we get any of it from China, but I definitely know that we get some from, I think it's like Washington and Oregon and that kind of area. So what the hell? It's a bad flu. It is lethal. It's not lethal to a lot of people. It's not a plague, but be safe. Do whatever precautions you want, but don't go buying up stuff and putting people into a panic. And going out into the store right now isn't really the smartest move. I went to buy pickles and chips because I'm a child and I own a meal prep company. So whenever I go out to the grocery store, I feel like a child anyway, because I'm buying like Enlightened protein ice cream, Stacy's pita chips, roasted jalapeno, awesome. And then pickles. The Fresh Market pickles are amazing. They've got so much extra mustard. If you're a picklehead like me, definitely check those out. I go with the slices instead of the spears. I used to be a spears guy, but I go with slices because now I feel like slices are less of a commitment. I can just pop a slice in my mouth. I'm good. I don't want to eat a whole spear. Just like eating a whole pickle versus a spear. The whole pickle seems like such a commitment. You're like, okay, kind of over it halfway through. This is a lot of sodium I'm taking in, but that slice is perfect. Pop 1 or 2 slices in your mouth. Gonna go home tonight and have some pickles, because I ventured out into Fresh Market last night. Yeah, there were some barren shelves, but all I can think about is, of the stuff that's left, how much of this has been sneezed or coughed on. My fiance got her doctorate in infectious disease medicine. I remember the first night I met her and she told me that. I was just like, I feel so stupid. And haven't felt any difference since. But yeah, so she's been running me through everything and how long a sneeze stays airborne and the difference between all this certain stuff, all the mutations that it's going through on the like HNQRORF8 and 1 with all those same letters. There's different mutations that it's having or something. Those weren't at all right. One's 8 and one's 1, but there's a bunch of letters like ORF, blah, 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 blah. Looks like a license plate. I don't even fully understand it, but yeah, so anyways, walking down the aisles, that's all I'm thinking about. And I get the chips. I'm like counting my breaths. I was in the supermarket for a total of 31 breaths, and I was moving kind of fast. Got everything out, and then as soon as I walk in, I'm kicking off the shoes, wiping down everything, and putting it in my pantry so it's safe and sound. Probably didn't need that tangent about pickles and shopping, but there you go. Again, I'm so tired. This is definitely not going to be the best video. Good thing nobody's watching this live, at least. So I'll just be useless in someone's past. It'll be your present, though, my past. So I'm already over it by now. Yeah, that's all I've got for you guys. The site, I can't wait to walk you guys through. I can't wait to walk you guys through the site, the back end. Now I've got nothing to show you. If we went to our website, fitfoodfresh.com right now, we could go through some of it. But as soon as we go to the menu, here's some more fun stuff to talk about. So some of the issues, I don't remember if I told you this already or if I told you this in the other video that I'm not going to be posting now, as I said, but I had negative 20,000 some odd dollars in my credit account. We had some members who were calling and saying that they had $15,000 in credit. Some are just $33 in credit, 160, 380, like all these random numbers. Sometimes it's a round number. Sometimes it's a number with some pennies on it. And it's just all this random data that they were using for testing. So they're using funny numbers like 20,000. Well, now when it's in someone's account negative, they're like, what the hell? Thankfully, it was mine. I haven't had a call from a member yet to tell them that, to tell us that they've got a negative $20,000 balance, but they're going through it now. And we took down the menu because with those credit imbalances, people putting through the orders, we have a whole bunch of issues. Number one, a lot of people getting free food, which is probably what happened, and we don't even know how much last week. And then also some people probably, I don't think they'd get overcharged with that balance, but they probably wouldn't be able to place an order with a negative balance depending on how the code's written. I don't know. Maybe it'll just give them free stuff. Who knows? Websites are funny like that. Like they decide to work one day and then decide to self-implode the next day. How does it go from working just fine to needing like 2 weeks of intensive repairs? I have no idea. It's crazy. In this other site, we've already put 10 grand. We've got 2 teams working on each site. We've got one trying to get the old one to work, and we've got the other team trying to speed up the new one. The new one went up, like I said, Thursday night or Friday. Then we had to take it down over the weekend, and our plan was, okay, the old one's fixed enough. There I go, touching my face. The old one's fixed enough to just rush it and get that back up. Or not rush it, but we'll get that one up. Switch back to the old site. Let us take some time in doing the new site the right way. Should be done by, another week or so. And then we'll switch back to the new site. Seems a little stupid. Sucks, but it's the reality of the situation. Switch back to the old site. Now there's some stuff that used to work, and it's not working. So, I don't know what's going on. We're going to have to be manually billing people. We were doing that today. We're going to have to be doing it tomorrow. And just sucks. We have this, there's something called a cron, and it's an automated, it's like a cron, like chronological. It's a time-based automated software or program command. So like at X time on X day, place orders or bill people or change the menu or something like that. So we have those set up. They're only set up in the old site. They haven't been built out in the new site, even though we thought they were. This is one of the things that the old programmer said he did and didn't do, unfortunately. And we've already put another 10 grand into the new site that was already, on the 24th, it'll be a year since we started. It's supposed to be a 3-month project. So on the 24th, it'll officially be 9 months overdue. It was due June 2nd. So it'll be even more than that. I don't know. But yeah, so on top of paying that and waiting, 3 times the projected time length for it, we still have another 10 grand we put out, and it just sucks, and we still don't have the project done. And it'll probably be, I wouldn't be surprised if it's another 5 grand plus everything we've been paying to have the existing site fixed, which we won't need as soon as the other one. Like, we're paying so much money and we're only going to need one of them. It sucks so bad. Now we're down some people, put in some extra work, got some new people coming in, a lot of changes, training. The number one thing is trying to protect our reputation and the expectation. So we've got to accept that there are probably a lot of people out there we don't know about yet who didn't get the order that they wanted, and we have to be ready to handle that from a customer service perspective. Our Yelp and our reviews aren't what they are because we don't mess up. We have bad reviews, but the good outweighs the bad because we are so aggressive and dedicated to the idea of making up for it, and that's something that's invaluable. So I kind of went all over the place with this one. I'm going to wrap it up now because we're at 30 minutes, and that's ridiculous for anybody to listen to me for that long. And we'll wrap it up there. We talked Corona, we talked customer service, we talked website, did a little bit of therapy about all the stuff that's going wrong. I'm going to get some food, let my voice rest, drink something warm, get some chapstick, and get out of here. If this is your first video, first time you're seeing me, subscribe, like, comment, check out the links in the notes. I've got ways to reach out, do consulting. I've got a free ebook. I've got the private group that if you're serious about doing this, private group's where you want to be. If you're still exploring, check out the videos. I've got so much free content. It's a free ebook. I've got a free mini course on how to start a meal prep business with just $500. We're busy right now. If we had a site, we would definitely be up this week. I don't know when the best time to start a meal prep business would be, but right now wouldn't be a bad time. So if you have the means or availability, or you're willing to, or ready, or you already started, like, this is the time that your service is in high demand. You can help a lot of people out. You can help them reduce their chance of exposure. Like I said before, I don't want to go shopping. I rarely shop, and now I'm so conscious of it. I can't imagine all these normal people normal people as in people who don't have a meal plan company or meal prep company. Those people have to go out and shop all the time. I could do it once a month. It depends on how bad I want pickles, how fast I went through the last jar. If there's a sale and I buy 2 pickles, I'm not going back to the store. 2 jars of pickles, I'm not going back to the store for a month. So, yeah, not a bad time to start. There's a lot of people who need your service. Not a bad time to try to grow, reach out. People who are using your service know people who would need your service. This became a higher priority for people. You are providing an amazing service, so also make sure that you don't extend your reach beyond your grasp. I think that's the term. Don't try to grow too fast. Make sure you can fulfill your orders. Make sure you're able to provide food. We've had some companies that we've seen who have, it was Decine Grinds, great company out of California. She sources a mixture of retail and from Restaurant Depot, and I've talked about Restaurant Depot in the past. They're a chain in the States where it's a retail center for wholesale purchases. Well, if you can walk in with a retail license and buy anything, that place is also going to suffer the same kind of plight that the normal retail places have, like Walmart, because now all you need is a wholesale certificate and you can drive your minivan here and fill up. With purchasing from companies that require like a $500 order for you to get a delivery from them or something, it's easier to source because there's not the same rush. Businesses aren't rushing out like people are. You don't have that same instant, like I said, irrational demand on the supply. So they're not being overwhelmed. Restaurants are also slower right now, so they have some extra inventory right now. They're being really nice to us. The pricing, they're kind of at our mercy, because we're one of the businesses who can be expected to grow if done the right way through this. So If you are able to order that way, great. If not, you want to make sure that you secure some way to do it. One way might be, sorry, I was acting like I was ending this. I just thought about some other stuff. One way might be finding a restaurant, whether you know one or not, trying to make friends with a restaurant who can put an order in, or you can piggyback on their order and get things delivered. It's also a benefit if you can't make that minimum $500 for a truck to drop off food. You might be able to jump on their order, and they'll probably order from several different purveyors, have several different trucks coming, and you might only have like $50 worth of stuff on one of the trucks, but it's still coming to one place, so you don't have to drive around like a madman or woman, because you're jumping on their order, right? Smart, right? All right. Sounds good in theory. You might have to pay them a little extra. I'm sure they wouldn't mind a little extra money, but between what you'd probably be saving on the volume discount that they purchase in and the time of not having to drive around to multiple different places or sacrifice on quality or whatever else. As far as what you guys should be doing, you should be probably limiting the menus, or planning to limit the menus to simpler items, simpler things to produce if you're planning on growing quickly, or if you were to grow. Cut down on some of the items, because right now it's going to a necessity. So if you have snacks and desserts and that takes up labor time and it's material cost, nix it. People are going to be buying meals. We're thinking about adding more family portions. We're discussing a few things. We're discussing what would happen if we start losing people to temporary illness and they have to stay home, whether it's because they're infected or they have to take care of someone, or they're just being cautious and we have to operate without them for an unknown amount of time. It won't be hard to hire right now because everyone's out of the restaurant work, right? So we could replace them relatively easily, even if it's just temporarily. And we would also simplify the menu. We've got a pretty extensive menu, so you guys probably don't have as much opportunity to trim as we do, but we can drop entire menu categories. One we would drop is the light portions. It's the same as Healthy Gourmet. It's just a smaller portion. We would drop that so we don't have to worry about the different portioning and setting up and everything else like that. We would also probably drop the snacks and desserts, as I mentioned before. And I forget what other menu was a relatively low seller. But I think just between those, we'd be able to save like a couple people's worth of work, still be able to put out the same level of product between, by not having the labor overwhelmed. And yeah, what else should I tell you guys to consider? If you're growing, make sure you have the delivery drivers. If you were to double, if you guys are smaller, you might be able to double. A company our size, I don't think we're going to double from this. It's possible. I shouldn't say that. But if you're at 20 clients right now, you can easily double. Can you deliver? 20 clients shouldn't be too hard. How spread out is it? In the private group, I showed you what our logistics looks like now. I posted a picture today. Check that out on the wall if you haven't seen it already. But in the private group, the Meal Plan Mafia, I posted a picture of just all these dots all over South Florida, and those were all of our deliveries that we did today. That was during the day. Crazy amount. I've never seen it like this before. But all right, I am going to get off now. I promised I would before. That was just a quick update. Again, if you're new to YouTube, or if you're new to watching me on YouTube, probably not the best video. A lot of doom and gloom, but hopefully you guys saw the opportunity that there is out there. And yeah, rock on. I think what I'm going to do from now on is I'll do live videos on YouTube, but then I'm going to have them, instead of having them posted on YouTube, I'll have them posted on the private group. So if you want to catch me on YouTube, make sure you like, subscribe, and you have the alerts on so you can catch me when I go live. I'm thinking I'm going to do the lives Monday. It's like a Monday meeting. That's how I'm going to remember it. So Monday meeting, I'm meeting with you guys live. Great time to do some Q&A. I can talk about this kind of stuff and just rant, or you can get me ranting about something else if you have a question. So by all means, do that. What else? So yeah, then this will be put on the private group. If you want to know about the private group, that's in the links below. I started telling you about that before. Private group is for people who are serious about getting started, but there's a lot of other resources, so definitely check those out as well. Other than that, this should be a regular thing. I hope I'm able to keep up with it right now. I'm crazy busy. Tonight I probably still shouldn't have done that. Should have given my voice some rest, especially with the symptoms being a throat soreness or raspiness first, but I'm gonna go get some rest and get ready to jump into the chaos tomorrow. You guys rock on.